All right, it's looking like 1:02, so I want to be respectful of everyone's time, and we will go ahead and get started with the webinar today. I want to thank everyone from joining, whether it's afternoon or morning where you're coming from. My name is Adam Barefoot, and I serve as the Chief Dental Officer for the Health Resources and Services Administration. And I am excited to talk to you all today about our oral health literacy and awareness education campaign, which we have termed A Healthy Mouth for Everybody. And yes, that spelling is intentional. Just some housekeeping rules. We will be recording this webinar. I know there's some questions about that. So if you have any colleagues that are unable to attend, we will be embedding this webinar along with a copy of the script, as well as a link to watch the recording on our new webpage. And I believe we'll be sending it out with a post-webinar email. Also, there will be a chance for some questions and answers at the end, so feel free to type questions in the chat. The Q&A box, I believe. I will try to get to as many as we can, but for those we don't, we will do our best to try to compile and maybe follow up afterwards as we are able. So again, today we're going to be talking about oral health literacy and this campaign we are launching. And for those that don't know me, just a little bit about my background. I know I've had the pleasure of working with Polly and many of you on this call, but just a little bit about me. Before taking this role at HRSA as the Chief Dental Officer, I served for a little over 4 years as the State Dental Director for the Georgia Department of Public Health, where I was fortunate enough to actually do some campaign work there. But even before that, I spent a little over six and a half years working as a dental director in a federally qualified health center in rural Georgia. And so I saw kind of firsthand the importance of oral health really at the ground level, and gained a big appreciation for what education could do in people's lives, the concepts of population and community-based health. And so this really is more than just a campaign for me. It's something I am passionate about. And I can tell you that, at the time, I was told so many stories, so many personal accounts, people's concerns, fears, worries, thoughts about oral health, how it's impacting them. And I knew a lot of these individuals that were coming from a little small town in rural Georgia had no way of communicating with the broader community, didn't have a direct communication line with a lot of change makers, policy makers, people that are out there doing wonderful work, but just didn't have that mechanism of connection. And so I told myself at the time that if I was ever given the chance, I would carry their voices with me. And I hope to kind of frame this presentation today, coming from that lens, that I really want to do my best to reflect the voices of all those that maybe didn't have a voice before. And so with that, we will jump in. I do want to give a brief acknowledgement to our federal contractors, IQ Solutions, that helped develop a lot of these materials, as well as Captain Renee Jaskow, the former Chief Dental Officer at HRSA, who was very instrumental in some of the early stages of this campaign. So what are some just high-level webinar goals today? It's pretty straightforward. We want to provide an overview of A Healthy Mouth for Everybody, the campaign, and we want to let it be known to communicators and key stakeholder organizations, basically all of you, and describe opportunities for stakeholders to share and integrate materials and resources into their current strategies. I think that's going to be a theme throughout the webinar today. Is this really, we hope to be a partnership with you all as stakeholders. You all have wonderful networks and are integrated in areas that are maybe in places that HRSA is not. You have your own communication, dissemination strategies and mechanisms, and this campaign will be ultimately that much more effective if we are able to kind of leverage all of this overall capacity to hopefully do something we're all aligned on and really believe in, and that's improving oral health literacy and education in the communities we're all there to serve. So just a high-level overview, kind of the webinar outline. I'm going to talk a little bit about the introduction, the background of the campaign, the audience research and insights. There was some extensive kind of research done, and I'll talk about a little bit more, but trying to get feedback from the intended targeted audiences in developing these messages. And I will be honest, a lot of this was done before my time, but I've made the best effort I can to kind of learn about these processes and learn about some of the feedback that was received from this research process. Again, I want to give a special shout out to those that came before me that helped build this, because I could not have done it without them. And then talk about the materials themselves. We'll go into where you can find these materials. I won't go through all of them line by line today. I'm going to really give a high level overview, but really the goal is to just express what our overall intention for these materials are, and then give you access to them. And then we really hope that you can just run with them. They can help add capacity to your organizations, be a resource for you to help with your oral health education and awareness efforts. Be something that you can find useful, that you can tailor it maybe to your own individual needs. It's meant to be somewhat flexible to suit the needs of our partners and stakeholders, which ultimately comes to the overall theme: how to get involved, how to leverage all of your wonderful, like I said, networks, the capacities, the unique connections you all have to really spread this campaign message as far and as wide as possible. So let's jump in. So again, our campaign is termed and this was again developed through a research process, given feedback. But ultimately we settled on, or I don't say settled on, but we ultimately arrived at a healthy mouth for everybody. And while this was all developed prior to me coming on, it's something I really connected with. If you look at our logo here over on the right, so many things come to mind to me. And while it wasn't part of the creative process, it really hit home. I really love how the symbolism, is obviously that of a tooth, and makes you think of tooth, but also is personified and has these kind of human characteristics in the head on top, and then the natural kind of heart shape in the middle. This was again something that the target audiences that helped in developing this really identified with, and I think it just kind of sums up something we all know, that oral health is key to overall health. It's is key to overall well-being as people, and with overall oral systemic connections and things like that. So it's just a very simple symbol that I think encapsulates kind of what we're hoping for this campaign. And then a healthy mouth for everybody, our campaign slogan, or really kind of catchphrase that was developed. I know a lot of people are probably looking at the words everybody and seeing it split like that, and that was intentional. That was supposed to kind of be a play on words, because what we do mean is that it is inclusive of everyone, that it's important for all people, hence everybody, but also that connection to the body, to overall health, and that I think is really what we're trying to convey with that overall slogan, that logo and message. And this campaign basically is coordinated by HRSA's Office of Special Health Initiatives to aims to raise awareness about the connection between oral health and overall health, sort of as I've been talking about. And as far as the highlights of the messaging, we try to talk really high level about the importance of taking care of one's oral health at home, as well as some things beyond kind of the behavioral aspects at home and behavioral change that will lead to good daily habits, but also things just like going to see the dentist so we can detect things early. Really a lot of upstream focus that goes beyond, the downstage things that unfortunately so often end up being the result when patients aren't aware and don't have those foundational values established very early on. And again, I'm not going to try to dive too much into my own experience, but again, this is something I saw so much working in a health center, and just if this message could have been conveyed to so many of my patients earlier on, I think it would have changed their overall trajectory and oral health very dramatically. So I'll spend the next few slides, again, going into kind of the background of the designs and the goals of the campaign. Before I get too deep into the campaign history and the background and how it was developed, I do have one slide. I think it's important that we at least touch on it. I know this is kind of preaching to the choir. I know that many of you on this call are very aware of the sobering statistics when it comes to oral health in this country. And while I truly believe so much great work is being done, and we've made a lot of progress and a lot of improvements over the years. There's a lot of work still to be done today. Just some high level statistics. 1 in 4 adults in America has untreated tooth decay. When we look at the childhood population, 10% of children ages 2 to 5 have untreated tooth decay. And whenever, as just a pause, whenever I see a statistic about children, it really hits home. I know many of you are familiar with the story of Diamante Driver, the very tragic story that hit all of us very hard, where a child in Baltimore, Maryland, unfortunately passed away in 2009 due to complications of a dental abscess. And so that spoke so truly to me, because whenever I see statistics that involve children, I think any one of them could be the next Diamante. It's not about trying to scare people, but at the same time, we don't want something just so awful and so tragic to have to happen to draw attention to it. And so when I see statistics like this, it's so much more a call to arms to be proactive when it comes to spreading awareness, spreading the message, and the importance of oral health. Beyond that, looking at some older populations, 17% of people over the age of 65 are completely edentulous, meaning without teeth at all. I remember growing up, my grandmother didn't have any teeth, and it kind of felt like something that we were past. But it's important to realize that this is still something that is very real for our older adult population, and it has a lot of dramatic impacts on things like nutrition, and dietary function. And it's, again, I'll get into stories in a second, but just one last final statistic: 42% of the US population has some form of periodontitis, so running the gambit kind of a dental decay and gum disease. All these statistics were taken from the Oral Health in America report that was recently released. And I do think things like this are very important to tell our story, to tell a high level framework of why this is all important. But whenever I see slides with statistics, I'm reminded of my own personal experiences with this and the stories, the faces, the people that are behind the statistics. And I know many of you all on this call, again, preaching to the choir, you have your own stories. We could probably put a novel together of people in the chat of just, the things that touched our hearts that really made an impact, that go beyond the statistics. I think of the young woman who was 24, and when I was in residency, made her not her first, but second complete denture because she had all of her teeth extracted as a 17-year-old. I think of the 2-year-old that I was on a pediatric rotation dental school and had to have all of her teeth extracted under sedation in the hospital. I think of the middle-aged man, 45, that came into our federally qualified health center and still had a fair number of teeth and actually not a lot of decay, but hadn't been to a dentist in probably 15, 20 years. And I thought he was just coming over cleaning, and I had to inform him that the periodontal disease was so significant that he was going to need to lose all of his teeth and be, in a denture, essentially for the rest of his life. And, I think it's important to have a combination of the statistics, because they are critical, and the evidence-based approach and that messaging and helping people understand the depth and breadth of the problem and the issue. But those stories behind the statistics are always what really get me. And again, I know I'm preaching to the choir here, because I know so many of you have those same stories. And it's just a good reminder to sort of set this whole framework before we get into it, of kind of why we're all here today. So getting a little bit about the history of how this all came about and the design of the campaign. Basically, a few years ago, Congress tasked HRSA to develop a evidence-based, data-informed, and audience-tailored communication campaign plan to improve oral health literacy for the HRSA constituent populations. And Congress specifically called out target populations for this campaign to include caregivers of young children, people with HIV, people living in rural areas, and people who get care from HRSA-funded health centers. These are our priority target populations. And when we say HRSA-funded health centers, it's a little bit of a nuance, but for the most part, if you're familiar with the term FQHCs or lookalikes, that's a large part of what we're kind of talking about when we talk about health centers. And as many as you may know, these populations align very directly with a lot of the keystone populations that HRSA programs serve across our offices and bureaus. And so after this request from Congress in the early design phase, basically just the first year was very research focused. There was 3 iterative rounds of research that included things like focus groups and cognitive interviews through samples and demographics that represented these populations. And really, they were there to kind of test some of the materials that we were building upon from some older materials that were kind of the basis of at least the start of some of this development, and then help kind of refine and finalize these oral health materials, even things like the logo, the colors, the slogan, and then kind of help solidify the strategies and tactics to help resonate this campaign broadly. And so based on some of that feedback, we developed a series of goals, and I'll talk about kind of how we arrived at these goals. But really, it's looking at the perceived importance of oral health, and how can we improve that perceived importance, and then make that next step, that connection to knowledge of the oral health problems that can impact other parts of the body. I'm the worst and guilty of this. I want to dive into the PubMed articles and everything and talk about the oral systemic connection. That's all well and good, but we need to have better key concise messaging that really hits home with that end consumer, that end person in rural Kansas that's just trying to get by with the all the other factors that are important in their life, and be respectful and culturally responsible and cognizant of all those other challenges they're facing, but at the same time make the connection of that importance and how it connects to their overall health. And then also, once we establish the importance of the messaging and hopefully convey that to the end user, the consumer, the resident, the patient, we want to look at things like behavior change and how we can make an impact with our messaging to do things like improve the chances that you're going to see a dentist or a dental provider in the next 6 months. It's so key to have early detection, and that's why we have some periodicity schedules and needs for regular checkup and diagnostic imaging and being seen by a dental provider. But also at the same time, good behavior changes at home, things like likelihood of performing at-home preventative oral health behaviors, just simple things like brushing and flossing. These are common things I know, and I myself as a dentist, I know we've been shouting for the rooftops for a long time, but how can we make that message more effective? How can we make it hit home and actually resonate more with that target population we are trying to serve and trying to really help? And we go beyond things like nutrition and normal dietary habits that are helpful and reduce chances of oral disease and things like that, but just simple things, but at the same time making it something that they can incorporate into their daily lives that doesn't feel like a burden, that doesn't feel like this is just the same lecture I've heard a long time, through some of the ways we develop the messaging. And so I think that's really important, and how this all came about. And so, those may sound like obvious goals, but it is important to get the feedback of how they kind of arose. So again, this is audience research and insights. This is from focus groups and interviews made up of constituents of the populations, the target populations we intend to serve. And at a very high level, a lot of these initial questions just revolved around basic concepts of like, do you think oral health is important? And many times participants did agree that taking care of one's oral health is important. And that, a general understanding that, okay, poor oral health is probably bad for other things. And, I am not a survey designer. I don't pretend to be one, but I think, there's probably a little bit of response bias that are any of these. I know I would probably say, things that, you're kind of teasing out as something you should be shooting for. And not to totally, knock it, because I think there is some level of understanding of the importance, but I think the bigger question is diving deeper into what that means, because even though many people said that oral health was important and that they connected it to other issues in the body, when they're probed a little bit deeper, the interpretation of what that means, it varied a lot. and personal experience influence the participants' opinions a lot on how oral health impacted them and where it kind of fell on their scheduled needs. And whenever we get these discussions, just me personally, I'm always drawn back to Maslow's hierarchy of needs, which it's like the most complicated academic concept that we talk about in academic circles, but like is so well understood by the population without even going into the academic frameworks. And, it really comes down to, what are my fundamental needs on a day-to-day basis when it comes to, staying healthy, keeping my family safe, living a happy life. And there are a lot of competing priorities. And so I think it's really important that we understand as a community how these are all being juggled in patients' mind. And when they say something as simple as, oh, sure, oral health is important, what do they really mean by that? Unfortunately, I think our perceptions change over time, and they shift depending on the circumstances we are in. And so often, unfortunately, our definitions change, and I saw it in my patient populations on a day-to-day basis, of noticing the impact it was having in their lives, sometimes in such a negative way. Again, not that everything comes back to personal story, but I had a patient one time that just was coming in because he said he had a bump on his gum or on his tongue, and he just wanted it checked out. Again, working in a rural health center, and no pain, didn't think anything was wrong. And he comes in, and I could immediately tell this had a high risk of being something very serious. Long story short, I was able to refer this patient to an oncologist and get him in the right care and and they were able to do biopsies. It turned out to be cancer, a very advanced stage cancer. We tried to follow up with the patient, and very sadly, months later, I found out the patient actually passed away. And all stories don't have to be that extreme or that tragic, but it just goes to show how the framework of what that means of importance can change so rapidly, so quickly. I think of patients that had gotten to very far downstream levels of disease and how much it was impacting their day-to-day life, their ability to do a job, their ability to take care of their grandkids or their children, their ability to participate in just the day-to-day functions of society that may have given them joy. Patients that were going to church and that was their one social outlet for the week, and no longer were able to. And so I think when we hear somebody say, oh, sure, oral health is important, it's important to take a step back and understand what they really mean by that, and are they interpreting it in the same way you're interpreting it. And we have a job to, again, be sensitive, be respectful, but convey what the impact that can create in their lives, and how we can provide messaging that is in line with how they can best receive it, incorporate it, and make behavior change that can benefit them long term. And so kind of digging beyond that, we ask things around barriers and misconceptions and things like that really started to emerge kind of a deeper understanding. And I don't think that, many of you would find this surprising, but things like financial challenges were a really big issue that emerged from these focus groups. And I will be honest, we can't state that this campaign is here to break down every access to care barrier that exists. It's just one piece, and we hope to address where we can, where it has a proper place and fits a niche. So for things like financial challenges, it wasn't just financial specific, but it was the unknown. It was the unknown about cost. And so we have to know, for at least the provider side out there, the providers I'm speaking to, having transparency, having that conversation, knowing that the patients may be coming there terrified of what this means for them, and having our discussions, our communications are just face-to-face, human-to-human level discussions on a very basic level. Understand it's coming from that context, understanding where they're coming from. And so having transparency, having sympathy for where they may be. I think there's an opportunity to talk about how, yes, there may be a financial barrier, but oftentimes, delaying treatment, delaying issues can result in higher financial costs, more invasive treatment, perhaps even a more, a higher financial toll, emotional toll, by letting things kind of continue. And we can do that in a way that is, again, respectful to the patients, that they can interpret and how it best fits their priority of needs, and hopefully adjust accordingly so we don't get to these further downstream problems. There was actually one participant in the interview process that described how they let a bad tooth go unfixed because fear of cost, and ultimately led to an infection that led to a vision loss. Had that patient had more kind of nuanced perspective of the overall picture, I don't know that that patient could have had a different outcome, but I would like to at least think that good oral health awareness and education could have been one added factor that could have played into the part of that decision-making process. Participants also discuss a need for information around coping with anxiety and fear when it comes to going to the dentist. This stemmed from both unknown financial costs, as I alluded to earlier, but also the perspective of pain, of unpleasant procedures. And from my own experience, probably also fear of an anxiety of kind of the shame of what they're going to hear, and how that reflect on them, on their own oral health. And so we need to really be cognizant of that as a community. Whether you're in a clinical setting or non-clinical setting, how we're developing those messages that won't reinforce those fears, that won't reinforce those biases and anxieties, and can just share with them the information they need to know to make an informed decision on their own health. Several participants described HIV fear or fear of discrimination because of their HIV status. I think we've come a long way in the dental world. I like to think our dental colleagues have done a wonderful job of improving their own knowledge, education, and treating patients with HIV. Some of the nuances, some of the specifics that happen and are related to, added pathologies or considerations for patients with HIV when it comes to their oral health, and vice versa. Immune compromisation and infection risk. But it's certainly still in the minds of that patient population. That's something we need to be aware of. Here at HRSA, we have many parts of the Ryan-White program that address oral health, both direct clinical services at a local, state, and levels in between. But even something like Ryan-White Part F is really specifically geared towards provider education and treating patients with HIV. And so I think it's something to be aware of at the provider level, but also at the patient level, that this is still something that is considered a barrier. And so when we're talking about communication strategies, how to be effective and inclusive to incorporate messaging that will resonate in the populations we are all here to serve. A handful of participants also questioned facts about broader impacts of oral health and medications. So things like dry mouth, they may not be fully aware, but just know that medications can have aspects on oral health, whether that's HIV medications or just broader medications in general. There were some questions that actually did arise from the focus groups about things like children and their impact on school and ability to focus. I'm actually glad this is permeated through the community, but as many of you know, that dental decay is the most common chronic disease of childhood, and it's about 5 times more common than asthma. It's one of the most common reasons children miss school for a health-related issue. And so, taking that conversation beyond the mouth, taking it beyond the dental visit to how it's impacting the development of a child, cognitively, socially, emotionally, it can be done in a way that is informative while still being respectful of the patient, in that state they may be in, that state of heightened anxiety and fear, possibly even shame, where we have a great opportunity to empower them in a way that makes them feel better informed, more confident to make a decision that will help with the overall health of their family, of their children. And that is something that is a big responsibility, I think, on our part. And then actually a few patients were aware of things, probably not the term oral systemic connection, but just connection from the mouth and dental health to overall health. And so again, those are all great opportunities to talk about that oral systemic connection. You don't have to necessarily use that term, but how, yes, oral health has been connected to things like heart disease and diabetes and, improvement in one. We don't know exactly how the connections fully are there, but, improvement in one may lead to improvement in the other, and how this is all a connective, interactive system that we need to be aware of and attacking kind of from all angles and multidisciplinary approaches. Another insight that was provided, kind of on a positive note, was that that many of the respondents did note a good kind of self-perception, self-esteem, when it came to their own definition of a good smile and overall appearance. Which I think we all as a society are connecting these mental and emotional well-being aspects to the broader sense of health and even oral health. Sadly, on the flip side, many of the participants also noted that poor oral health did affect things like self-confidence and social experiences, and even very practical things like a job interview. I can tell you in my personal experience, I literally had this exact event happen. I had a patient that had been out of work for several months, and had gotten a job interview. This is probably coming out of the recession in 2010, 11. His first job interview in a while, was so ashamed of her mouth and the way it looked that she ended up not going to the job interview. As an aside, but along the same lines, I had a patient that was employed, but had a lot of dental pain, didn't have a dentist, came in to see us at the health center. They were walk-in. I didn't have time to treat that patient that day because we were so slammed, but I gave them an antibiotic to deal with the infection, did a quick triage, took an x-ray, said, if you come back tomorrow morning, first thing, I will find a way to get you in and take care of that tooth. Patient showed back up the next day, and I was able to pull the tooth, get the patient out of the pain. And I was, felt very happy that we were able to do this and do this for the patient. Well, I found out later he had gotten permission from his employer to be off for that first day, that first visit, where we just did an assessment, but hadn't gotten permission to be off the next day, but was in so much pain and just had to come see me, and ended up losing his job because of it. And so, that's just such a unfortunate and tragic story, but it goes to show it's so much more. We start at the level of the individual tooth, and that's how we learned in dental school, and then we broaden it to the mouth, and then maybe we brought it into the patient, and then we incorporate things like emotional well-being and mental well-being. But it really has even beyond that, things like social and societal well-being. And I think that a lot of people are starting to make that connection, whether in those specific terms or not, and that's all the more reason to treat this as just it is an oral health literacy campaign, but it can be so much broader than that when we talk about overall well-being, overall health, how people interact with their communities, their families, because unfortunately, when it comes to oral health, the negative side of things can be so damaging, so impactful. So finally, kind of how this all wrapped up, I think if people are involved in kind of, communication departments of their organizations, this probably won't come as anything new, but really the idea was to create, clear, concise messaging. That's the feedback we got from all of this. Things like, they were just kind of very simple, but it's important to remember phonetic pronunciation, clear definitions, plain language. One of the aims of this campaign is to improve oral health literacy among those who currently lack the information and skills to receive preventative services and treatment. But during this message development, there's a lot of prioritizations around kind of this simple, plain language for all the materials to ensure the people in the campaign that was intended for could understand and grasp the information. And we encourage you to take this information. We'll get into the actual materials in a second here, but I think that should be a theme, really making, whether it's cultural competency or using language, whether different standards, fifth grade level, or whatever you have to be using, that really are effective at conveying the message into the populations you serve, the communities you serve. This is really critical to convey a message in a way that can be incorporated, can actually be adopted and lead to behavior change that'll improve oral health outcomes. So again, this is kind of just a reinforcement slide. It just reminds you of the target audiences. Our original campaign that was funded through congressional appropriations really listed these groups: people with HIV, parents and caregivers of young children, people living in rural areas, adults, and really just the whole family who visit HRSA-funded health centers. And then it was briefly noted, but we really do want to reinforce the healthcare provider aspect. I'll be honest, HRSA does a lot of work really intended to reach that end user, that consumer, that resident and that small town community. But because a lot of our work goes through and works through organizations like yourself, grantees, who have those more direct connections at that level, that's why it's so important to work with you all as stakeholders, leverage your connections, your networks, your reach in those respective regional communities, because while we want to provide the tools and we ultimately want to serve those populations, you have added, value in your networks and your organizations that can really expand and amplify our reach to that intended user. And that's really what this is for. That's increasing oral health literacy in these populations, in the communities, at the end user level, at the grassroots level, to try to improve overall oral health outcomes and make really change in these areas. So now to the fun stuff. We talked about the actual materials. Again, I'm not going to dive into the details and pull up every little piece we have, but try to go high level here, respect for time. One of the first things we're doing is launching a new oral health website for HRSA. This is a screenshot here on this little laptop here. I think at some point we have our federal contractor kind of helping IT support in the background, taking questions. And I think they may put a link in the chat at some point, but to our new oral health webpage. It went live yesterday. This is a big deal, and it goes beyond me because there were a lot of pieces in place building this out before I even joined, but I'm very excited to launch this new webpage that kind of focuses on things to just improve oral health. We'll still be talking about our offices and bureaus and all the wonderful activities they're doing, and try to cross-link to all those things because they ultimately all support this work as well. But we're very excited about this. And when you visit this oral health webpage, you're going to see all the materials I'm going to talk about, including things like the campaign toolkit that is built for stakeholders, educational materials, and then I'll also put a link to this in the chat at the end. So beyond the webpage, some things we're doing are radio public service announcements, or PSAs. These are actually starting tomorrow, as long as nothing has changed in the last 24 hours. These are going to go on nationwide. Just kind of a reminder, call to arms of reintroducing people to oral health, calling them back to oral health. I know a lot of people kind of fell out of going to the routine appointments over the last few years, and this is really just a effort to remind them of the importance of that. It will be nationwide. However, we will be targeting and doing some paid promotion into some identified southeastern states that were identified because of the disparities, and especially in rural areas that they were facing. We also have a lot of digital brochures and posters. This is something that we want to make easily downloadable that you can incorporate, share through your constituent communication mechanisms with us, newsletters, distribution list, on websites. They can be printed out, they can be incorporated into a web page and embedded. We also have some social media promotion, some of which we'll be doing internally, but we have some kind of foundational templates that can be used and adopted and incorporated for your own needs. So we're very excited about this. Also, part of our efforts are what we're doing right now. We're reaching out to stakeholders. Again, want to call, this is a call to arms to you all to leverage our partner networks. Collectively, we are so much greater than the sum of our parts. And I think the ability for you all to reach out and to the constituents you serve, the populations you serve, your members, your whether you're dealing in nonprofits or your professional organizations or you're a health center, you all really do have a role in this. And all I can say is you mean so much in the dissemination of this campaign. We couldn't do it without you. And so that's a real big part of this. We'll also be working to disseminate information through HHS and federal partner channels as well. And I will be providing my contact info at the end of this presentation because we definitely want to be hearing your feedback. So again, I don't want to take time today because I could spend a whole hour talking, just kind of individually going through the materials themselves. But basically, if you go to the website, we have it all there. We've nicely packaged a digital toolkit of the resources for stakeholders like you all on the call. We have inside those things, inside those toolkits and on the website, we have audience tailored educational materials, things like digital brochures and posters. We did really pivot from direct printout and try to disseminate those to more digital that can be adopted a little more flexibly, but still can be printed out. We also have drop-in email language for things like newsletters that you can include. Again, these are just helpful resources. You don't have to, but we have ready-to-use social media content for different channels. Or for those of you that work in the media or public affairs role, things like the radio public service announcement. We've included the live read and the scripts, as well as the fully recorded audio PSA. And the stakeholder toolkit can easily be found on the newly launched oral health web pages that I mentioned. Oops, excuse me. And so lastly, before I kind of wrap up and maybe jump into some Q&A, just some idea for some best practices. Again, this is reflected in the toolkit. So this is just high level overview. And I have to, again, ask appreciation for our government contractor that gave a lot of feedback on this, because I am not a social media savant or expert in any way. But, thinking about things like the audience tailored posters, there's a lot of opportunity to put, stuff like that in, high patient populated or frequented areas, things like waiting rooms and clinical settings. For those that may be more in that field, operating, clinical facilities or health centers, you're welcome to print out if that's easier, or if you have, more resources for your own web page and maybe a social media person, web developer that can implement that. It's really meant to be something that can be both digital in nature or printed out in nature, depending on the needs of the communities you work with. Social media, we have kind of our own recommendations, but this really is supposed to be, for the public. It's meant to be spread as widely as possible. While we've created it and we'll be sharing on our own channels, kind of as is, we welcome you to kind of tailor it as far as how you see fit to disseminate it to your audiences you serve. We do recommend keeping messages simple and concise. We would love it and appreciate it if you can use, when you're talking about things like hashtags, using the healthy mouth hashtag. That does actually help us track, a lot of metrics for evaluation and KPIs, which I have to look up because it's beyond my knowledge, and key performance indicators and some things in social media that are just kind of help track quality metrics. So again, we appreciate you. And this is again, the Olson Toolkit to try to kind of reinforce our messaging, but we do want it to be nimble to help ultimately make the most impact to the populations you serve. And for things like the radio PSAs, whether you're making a request for the script to be read on the air or the recorded PSA to be played, especially if you have kind of those networks and you're used to kind of working in that platform, we would suggest maybe trying to make that request around time of national observances, because things like, Children's Dental Health Month is just wrapping up right now. We might have missed that window, but we have World Oral Health Day coming up, I think March 20th. There's other opportunities along the way. Dental Hygiene Month. There's other things that, where it may kind of be more on the tops of minds and relevant. And so when making those requests, maybe more impactful, but, ultimately, your audiences, your regions better than we do. So this is really just there to empower you to build capacity and use this how you think will be most impactful. And so with that, I wrap up today. with some key takeaways. Again, we're here to talk about a healthy mouth for everybody. Our HRSA Oral Health Awareness and Literacy Education Campaign is a multi-channel campaign that aims to raise awareness about the connection between oral health and overall health. Some of the focuses have been launch activities, including publishing a new oral health webpage, running radio PSAs, promoting messages via social media, and more. We will continue to do this through our internal channels as well as other HHS agency channels. We have HRSA developed ready-to-use materials to help stakeholders reach their constituents. We encourage you to shout it from rooftops, spread it as far as wide as you can, use it in the most effective way you see fit. Within reason, tailor it to your target audiences that you think will make the most impact to make the best chance of behavior change, improve oral health outcomes. And really the materials are there to highlight the importance of taking care of one's oral health, basic home care, basic improved preventative behaviors, improved behavior change that can reduce dental decay, reduce dental disease, and improve oral health outcomes, and simple things like seeing a dentist regularly for checkups, trying to find earlier identification of problems, earlier intervention, and hopefully getting people building that foundation earlier rather than later. And so with that, I really just want to thank you all for joining today. Again, we couldn't do this without you. This is a HRSA campaign, but you all as our stakeholders are key players in this process and involved. And it's our just request that you'll be with us on this and help share it as far as you can, as far as wide. I respect you all so much. I know so many of you personally. I know you care about it as much as me. You're invested on a personal level that can't be put into words. And so I just thank you all and hope that you will join us on this journey of sharing oral health awareness, education, literacy, and promoting our campaign as best as you are able. And so with that, I'm going to link this here of how to get involved. Again, that last plea. This is our new oral health landing page. It's our standard landing page, but it kind of be rebranded for this campaign. Again, encouraging people to share campaign materials and information with your network. And then again, feel free. I know a lot of us have standing meetings and just check-ins and updates, and I'm happy to do updates around the campaign then. But don't have to wait to that, or if you don't have standing meetings with me, and just feel free to reach out. I wouldn't put my email here if I didn't want to hear your feedback. I'll do the best I can to listen to your concerns, all of your thoughts, just an open dialogue. If it's something that we can incorporate, if it's a way to partner, if it's a way to improve oral health, I will at least be a listening ear, just like I was a listening ear to all those patients years ago, and do my best to be a voice for all of you, and try to be in partnership with this along the way. So with that, I'm going to look and see if there's any questions I can answer. And I don't claim to be anything other than a simple boy from Georgia, so I will try to answer the best I can. I'll pick a couple, and if I can't get to all, I'll do my best to follow up even after the webinar. Somebody noted how likely to visit a dentist and not a physician. Not many different stats have been cited. Yeah, I've heard a lot of stats on this too. I do think, and hopefully we do have some non-traditional dental providers in this, especially when it comes to oral health education. I think we have a broad collective that can be important in this. I do certainly want to reach out to the dental providers out there. A lot of times they'll be on the front lines with the patients, but there is certainly a role for other medical providers, other oral health advocates. In a past life, I've spoken to school nurses and physicians and nurse practitioners and help community workers, home visitors. This is one thing that really, when it comes to just education, we have such an army beyond our normal oral health kind of workforce. And I think trying to incorporate as many as possible. I'm hoping other people outside of just straight up dental providers and are watching this, because I think there's a lot of value there. Let's see. So sharing this, somebody said, how are you sharing this interprofessionally? So the medical side is aware of this. That's a great question. It just pivots right off of where I just came from. We'll be working, we're sharing it internally with HRSA on our internal listserv. And so, I did mention that a lot of our offices and bureaus focus on these populations that we're here to serve. Not just on oral health, but broadly, they still focus on the same populations. And so what's wonderful about oral health is I think it's cross-cutting. I saw that at a local level, at a state level. It's something that again, we're putting the mouth back into the body. And so I hope a lot of programs internally see this, and we can partner and find ways to collaborate also across other agencies. But again, we do encourage you all. I think there are people on this very webinar that are outside of maybe the traditional dental provider scope. And I think there is a lot of opportunity there. When I was working in the FQHC, there was a natural infrastructure of team coordination of care. I can't tell you how many times I had a patient that came in for extraction. I took a blood pressure. It was 210 over 120. And I said, sir, we need to get you to our doctor right across the hall right away. And so it was a wonderful setting, at least there from my personal experience, to have that multidisciplinary approach. I hope there's opportunities for that moving forward. And I hope maybe some of the networks on here, have those connections that can build out those communication strategies. Somebody did note, are the educational materials available in Spanish? At this time, they are not, but we are continuing to develop the materials. We hope to kind of expand on this in future iterations. I can't speak to any details because that's still sort of under development, but it is certainly something we will consider. It's a very valid question. And, again, I just spoke about the importance of effective messaging, and that is something that is without question very, very vital to share these key messages to people that may speak other languages. And so within the ability we will certainly consider options to see what capacity we have to do that. Let's see here. Sorry, I'm running IT in the background again with this. So apologies if I miss questions. Again, I'll try to follow up in the time we have left. One question was with the connection between oral health and overall health. I touched on that briefly. I think this is something that many of you may kind of be aware of, but for those that aren't, basically studies have demonstrated a very strong association between things like dental decay and periodontal disease and conditions such as diabetes, heart disease, risk factors in pregnancy, dementia, Alzheimer's, pulmonary disease, certain cancers. That research is still being developed, and while there's very strong linkages and the linkages continue to get stronger, we're still researching how those causal pathways happen. But I think it's safe to say that it's at least elicited the conversation of how we all need to be working together, because it really reinforces how the mouth is connected to the body. And so beyond that, again, kind of getting beyond the biology of it, oral diseases can have a significant impact on the quality of life, which dives into the whole behavioral health, mental health, social, emotional well-being. And so I think it really is, just that reinforcement that we're all in this together. Our medical colleagues, our behavioral health colleagues, our, social services colleagues are all dealing with these issues. And we need to really come together to try to help resolve some of these problems. Somebody did note that many of the materials about young children are available in Spanish on the National Center for Health, Behavioral Health, and Safety's oral health page. To find it, oh, and my cursor just moved. But I believe the early childhood care and learning, it may have been answered. I'm sorry. To find it, Google ECLKC, Healthy Habits for Healthy Smiles. I can also tell you that the National Oral Health Resource Center, which is a HRSA funded organization through the Maternal and Child Health Bureau, while their target population that they're geared towards or is obviously kind of maternal and child health populations, they do have some wonderful materials that are in Spanish. Some of the older materials this was originally built upon through NIH have some of their original materials in Spanish, but we have not updated those as of yet. We will certainly let people know if we are able to provide those in other languages, including Spanish, and it'll definitely be on our radar. Doesn't like too many more questions. Somebody said, why did HRSA focus on oral health literacy? I do have somebody that already wrote a definition, which is lovely for me because I am not a linguist, but oral health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic oral health information and services needed to make appropriate health decisions. I think that's really the key final statement there. Low health literacy is associated with lower use of preventative care, poor health, poorer health, and high mortality rates compared to individuals with adequate health literacy. Across populations, individuals with lower oral health literacy are more likely to have poor oral health status. And so, again, I think that's a nice way to kind of sum it all up. Again, the campaign was originally appropriated by Congress, and that's what kind of got started. And again, the target populations we're here to serve. But I think we all, on a higher level, understand the importance of oral health literacy through our own lens because of what we see in our day-to-day work. And so I really just appreciate everybody coming here today. I'm sorry I couldn't get to all the questions. I know there's probably a couple more. I'll try to reach out to all of y'all as best I can. I do want to put our final slide up here just as connect with HRSA. This is just our overall agency page, and let y'all know if you're interested in other HRSA related programs. But again, feel free to reach out to me. You see the email there. Feel free to go to our webpage because it's going to have everything we talked about. And again, one just last call to arms, begging, pleading, personal request from Adam, who knows many of you. I just really appreciate all of y'all that can help spread the word, but beyond that, just all the work you're doing, because I know we are so aligned in this fight, and we share such a common interest in improving oral health in Americans broadly, and doing what we can to work together in that fight. And so with that, it's 2:00. I'll respect everybody's time, and thank you all for joining the webinar today. I look forward to working with you in the future and being engaged. Again, feel free to reach out to me. I will do my best to keep the dialogue going, communication going, and keep the fight going. So thank you.